What's going on, world? Hey, welcome. Hey, today is Friday. You already know what we're doing today. We are doing NCLEX questions. If you guys are new here, hey, so I am streaming both on TikTok and on the gram. So if you're over there on the gram, I appreciate y'all for rocking out with us, but you guys already know what I want. I need 1,000 likes. I need 100 people up in here. Sorry, I don't make the rules. I mean, I do, but I need for y'all to follow those. So make sure, hey, smash that like button. Give me 100 likes. Make sure you guys share. If you guys are in nursing school right now and you have not shared this with people in your cohort, what are you really doing? So shout out to everybody that's jumping in. I am streaming both here on the gram as well as on TikTok. We are going to go through some NCLEX questions. So I need for you guys to like, share, and follow on TikTok. I need 1,000 likes and I need 100 people up in here. If I don't get them, y'all don't get no questions. Instagram, y'all all right. Y'all gonna get this knowledge anyway. But I'm telling you right now, on Instagram, on TikTok, if they don't do it, y'all ain't getting them. So y'all better start motivating them. But hey, I want to know who you are, where you're from, and where you are at in your nursing journey. A little bit about me. My name is Kevin. I have been a nurse for almost 4 years, registered nurse from, and where you are at in your nursing journey. A little bit about me. My name is Kevin. I have been a nurse for almost 4 years, registered nurse months, but who's counting, right? 16 years, 4 minutes. Yesenia says, hi, I graduated in May with my BSN, taking my HESI exit on Wednesday. So nervous. It's okay, Yesenia. It's all good. Hey, being nervous is a part of the process, but you know it. You're prepared for it. Hey, go through all those major sections, which are exit HESI. So management of care, transitions, pharmacology, basic care and comfort, all the things that you would need to know with regards into taking your NCLEX. All right. Hey, we got 85 people up in here and we got 500 likes. What are we doing? Instagram. Hey, I want to know a little bit about y'all. I got 3 folks that's over there, but hey, but 3 is more than 0. So I'm going to give y'all this knowledge anyway. I want to know who you are, where you're from, and where you are at in your nursing journey. Oh my God. Like, you guys ever had a rock stuck in your shoe and then you walk and it's just annoying and then eventually you take your shoe off, kick the rock out? Yeah, that's Jill. What's up, girl? How you doing? Oh my God. I'm sorry. Hey, we got 100 folks up in here. I just want to let y'all know we got 100 people up in here. I need 1,000 likes. I'm almost there. Hey, at least give me 1,000 likes because you love my jokes. You know what I'm saying? California taking my exit on Monday. Shout out to you. Is it Lena? Shout out to you. Hey, we got 1,000 likes. We got 100 people up in here. The doctor is in. My man, Dr. Awesomer. What's up? All right, y'all, here we go. Hey, look at that handsome dude right there with that fanny pack. That's me. All right, y'all, here we go with the questions. All right, here we go. Question number 1. Which roommate would be most suitable for the 6-year-old male with a fractured femur in Russell's traction? Is it a 16-year-old female with scoliosis, a 12-year-old male with a fractured femur, a 10-year-old male with sarcoma, or a 6-year-old male with osteomyelitis? What are we thinking? All thanks to you. Wait, what happened? What'd I miss? It says, Kev, I passed my NCLEX on Friday. All thanks to you, ma'am. That's what I'm talking about. That's the type of stuff that I love to hear. Once again, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here taking their exam, ma'am, what would it be? And of course, congratulations to you. All right. Shout out to you. But what do we think the answer is, y'all? B, you meant B? You sure, Rachel? You sure? Or Raquel? I'm going to say Rachel. All right, I'm going to put you guys on a timer. You guys take forever, especially Jill, thinking that we're on her time. All right, y'all, what are we thinking? Hey, Kev, I passed my NCLEX last week. Thank you. Lizzie, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give, what would it be? Congratulations to you. You're a frequent flyer. So, hey, I know that you used to be here hanging out. So congratulations to you. Pass on some knowledge to us. All right. But the answer is B. It's a 12-year-old male with a fractured femur. The 6-year-old should have a room as close to the same age as possible. So the 12-year-old is the best match. A bed is available and the patient gets assigned. There are certain constraints such as sex, semi-private versus private, isolation issues, acuity, telemetry, and specialty needs. all need to be taken into account to ensure that each patient goes to the right place and receives the proper care. That's part of basic care and comfort, something that you learn at the beginning of nursing school and foundations, right? Cohorting our patients, like-minded people, issued type of patients. All right. Basic care and comfort is 6 to 12% on your NCLEX exam. All right. So shout out to everybody that got that right. If you didn't get it wrong, if you got it wrong, make sure you read your answer while it's correct, read your rationales to understand while it's wrong, and circle back and keep going. All right. Here we go. Question number 2. A client with osteoarthritis has a prescription for Celebrex. Which instruction should be included in the discharge teaching? All right. Is it take the medication with milk, report chest pain, remain upright after taking for 30 minutes, or allow 6 weeks for optimal effect? What are we thinking? All right. We got some people saying B. We got some C's out there. Hey, if you guys don't realize this, we're on the road to 10,000 likes. All right. We're on the road to 10,000 likes over here on the good old TikTok. All right. If I don't get 10,000 likes by the time we get to question 10, my throat hurts. Just saying. Just letting y'all know. By the way, if you're in nursing school right now and you have not shared this with your cohort, I don't care how you feel about them. Share it to them. All right. What they decide to do with that information is totally up to them. All right. Just letting y'all know. All right. Proud of you, bro. Killing it. Scotty, my man. I see you over there on Instagram. I appreciate you, brother. All right, y'all. Here we go. Here is our answer. Here's our answer in 3, 2, and the answer is B, to report chest pain, right? COX-2 inhibitors have been associated with heart attacks and strokes. Any changes in cardiac status or signs of stroke should be reported immediately, along with any changes in bowel or bladder habits, because bleeding has been linked to use of COX-2 inhibitors. That is part of health promotions and maintenance, which is 6 to 12% on your NCLEX exam, smaller section, but still a very, very important section that you need to know, because there are 8 sections of the client needs that are part of the NCLEX test plan, and health promotions and maintenance is one of them. All right. So shout out to you if you got it right. If you got it wrong, read your rationales, circle back, get the content, keep doing your Q&A, and keep it pushing. All right, here we go. Question number 3. A client with a fractured tibia has a plaster of Paris cast applied to immobilize the fracture. Which action by the nurse indicates an understanding of a plaster of Paris cast? The nurse handles the cast with with the fingertips, petals the cast, dries the cast with a hairdryer, or allows 24 hours before bearing weight. What are we thinking? What are we thinking? Everybody's telling me D. Everybody's telling me D. Okay, Yesenia's telling me C, so I was wrong. All right, Claire's telling me D. Jel's telling me no clue. I'm not surprised by that answer. So I'm just playing. Hey, so we're on the road to 10,000 likes. Make sure you guys like, share, and follow. Smash that like button, share, and follow. Also, I got these questions off of nurseslabs.com. They are free sets of questions. Yes, I said free sets of questions. You guys can go over there and check those out for yourself. Maddie, I see you. Don't think you can sneak in here. Don't think I didn't see you come in here. All right. So let us find out what the answer is. Let us see what the answer is in 3, 2. And the answer is D. It allows 24 hours before bearing weight. A plaster of Paris cast takes 24 hours to dry, and the client should not bear weight for 24 hours. After the process of applying the casting material is complete, the material will start to dry in about 10 to 15 minutes. The temperature of the skin might rise as the plaster is drying because of a chemical reaction that occurs. When plaster is used, it can take from 1 to 2 days for the cast to harden completely. All right, that's part of safety and infection control, which is a little bit higher, 10 to 17%, 10 to 17%, a little bit higher in the NCLEX ladder when it comes to the client needs. So shout out to everybody that got that question right. By the way, if you got it wrong, or even if you got it right, you're going to read your rationales. That is how you're able to retain the information. All right, you get the content. You apply the content to the question using your critical thinking, and then you analyze, and then you select your best clinical answer, safe clinical answer. And if you get it wrong, you're going to read your rationale. That is what you have to do. All right. So shout out to everybody that got it right. And if you got it wrong, you know what to do. Here we go. Question number 4. The teenager with a fiberglass cast asked the nurse if it will be okay to allow his friends to autograph his cast. Which response would be best? All right. Is it A, it will be all right for your friends to autograph the cast. B, because the cast is made of plaster, autographing can weaken the cast. Is it C, if they don't use chalk to autograph, it is okay? Or is it D, autographing or writing on a cast in any form will harm the cast? What are we thinking? Shout out to all 244 of y'all out here rocking. We're doing NCLEX questions out here for RNs and LPNs. Got them off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those questions out for yourself. The whole point of doing these questions every Monday, Wednesday, and Friday is to get you guys into a routine. Get into a routine of studying, all right, called time management. All right, you got to get your time management under control. All right, if you don't have that under control, you're not going to know how to start, you're not going to know how to get through it, and you're not going to know how to end it. All right, dumb question, to be honest. I didn't ask you if it was a dumb question. You're just supposed to answer the question. So you must be new here. I'm just saying. It may be a dumb question, but here's the thing. Remember, on NCLEX, NCLEX has well over like 10,000 questions, right? Has well over like 10,000 questions, right? Even if you take the exam one time, hell, even 3 times, you're not even going to put a dent into the amount of questions that you could even get. All right. So you say it's dumb, but somebody may get a question like this. So it's only dumb because you feel it's dumb. All right, off my soapbox. But anyways, the answer is A. It will be all right for your friends to autograph the cast. All right, there is no reason that the client's friend or friends should not be allowed to autograph the cast. It will not harm the cast in any way. So answers B, C, and D are incorrect. Fiberglass has several advantages compared to plaster. It weighs less, so the cast made for it will be lighter, more durable, and porous. Fiberglass allows air to flow in and out. Fiberglass is the better choice in cast. To cast the limbs must be x-rayed during the healing process. Is also available in a variety of colors. That's part of basic care and comfort. Bro got so upset. No, I don't get upset. I'm just letting you know what the deal is. Some people come in here and they're just like, hey, like that's a dumb question. Okay, I didn't ask you if it was dumb. I'm just telling you to answer it. It says, bro, I took the NCLEX yesterday and it shut off at 85 and I'm freaking out. That's okay though. That's okay for you to freak out. That's all right for you to freak out. It's part of the process. Part of the process, all right? But just know you prepared well for that exam. You leave, everybody leaves the exam feeling the same, like they feel defeated, but you prepared, working your way all the way up to that. And I'll be the first to tell you congratulations. So you're good. You good to go out here, Nicole. You good? Question number 5. The nurse is assigned to care for a client with a Steinman pen. During pen care, the nurse notes that the LPN used sterile gloves and Q-tips to clean the pen. Which action should the nurse take at this time? Is it A, assisting the LPN with opening sterile packages and peroxide? B, telling the LPN that clean gloves are allowed? C, telling the LPN that the registered nurse should perform pen care? Or D, assist the LPN to clean the weights and pulleys with peroxide? What are we thinking? Shout out to all 300 plus of y'all. We're doing NCLEX questions. I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse hanging out here with us, what do you do? What do you do with your life? A little bit about me. I've been a nurse almost 4 years. I worked ICU, OR, and PACU. Also, I was in the Navy for 16 years. I just got out this past January. Last 9 years of my 16 years, I was an instructor. So I enjoy teaching. This is why I brought my talents to TikTok for y'all. So shout out to all y'all that are here participating and getting your learn on here on this Friday. I'm an RT, should have went to what? It says I'm an RT, should have went to nursing school. Nah, girl, you good. Hey, shout out to my respiratory therapist. I love y'all. I learned everything I ever needed to know about the vent from a respiratory therapist. You know what I'm saying? So shout out to y'all. Oh my God, from New Jersey. I live in Tennessee. Take my NCLEX on the 25th. You Gucci. Thank you so much. I need this. Nadia, you are welcome. 20 years LPN. Shout out to you, Sean. Shout out to you. But the answer is A, assisting the LPN with opening sterile packages and peroxide. The nurse is performing the pen care correctly when she uses sterile gloves and Q-tips. All pens and wire sites must be cleaned daily. Basic pen care will be performed once daily by the hospital nursing staff prior to discharge from the hospital. Following discharge, the patient and family will go to the clinic for pen care, teaching, and instruction. That's actually part of management of care. And if you are an LPN taking the exam, that's part of coordinated care, right, which is the largest section on the NCLEX at 18 to 21%, all right? Miss Lovable, thank you for the heart me. I appreciate you. All right. So no, management of care is the largest section. That is your assignment, delegation, supervision, priority. Who do I see first? Right? Those are those type of, stable versus unstable, acute versus chronic, right? Those are the expected versus unexpected. That's your management of care type of questions. All right. So you better know them. You better know them, because I'm telling you right now, you can't go out here working as a nurse and not knowing them. But hey, ladies and gentlemen, check this out. I have a test taking tip PDF for you guys. It's a free download. If you guys are new here, you guys can go over there and check that out at thebootnurse.com, or you guys can go into the link in my bio, and it's 42 pages. It's free. Some test taking tips to help you conquer the NCLEX. All right. You guys can go over there and check that out on Instagram. You guys can go over there and check that out as well. That link is in my bio. But yeah, go over there and get you that knowledge. Not a fanny pack though, because everybody needs a fanny pack. I'm just keeping it real. But here we go. Question number 6. A child with scoliosis has a spica cast applied. Which action specific to the spica cast should be taken? All right. Now, if you don't know anything about cast, you might want to circle back and just look at what casts are, right? Look at which ones do what and what to look out for when they are being applied. All right. So is it A, check the bowel sounds, B, assess the blood pressure, C, offer pain medications, or D, check for swelling? I know some people are just like, oh my God, this is easy. Okay. Well, NCLEX has easy questions. Just saying. All right, what are we thinking? What are we thinking? Shout out to all 348 of y'all out here rocking. We're doing NCLEX questions. We are on the road to 10,000 likes. Hey, we're on question number 6. If I don't have 10,000 likes by the time we get to question 10, it's going to be a long, drawn out Friday. I'm just saying. All right. Haven't done peds yet, but D, that's okay. That's okay if you haven't done peds yet. Because, hey, by the time you do get the peds, you'll understand. All right. Here we go. The answer is A. Check the bowel sounds. OK. A body cast or spica cast extends from the upper abdomen to the knees or below. Bowel sounds should be checked to ensure that the client is not experiencing a paralytic ileus. Auscultate the abdomen for bowel sounds if bowel sounds are present, or the patient reports that they are passing flagellants. Clear fluids can be commenced, and a parament can be administered. Patients must not commence oral fluid if bowel sounds are not present, as this finding indicates an ileus. That is part of reduction of risk potential, which is the 4th largest section on the NCLEX. All right, at 9 to 15%. Will these questions come in NCLEX? So these type of questions are practice questions. They are free questions. You can find them on nurseslabs.com. But with regards to NCLEX style questions, I personally would not use these. However, the whole point of going through these practice questions is to help you practice and to get into a routine. I personally like Archer's types of questions, but then they have UWorld, they have Kaplan, they have, and those are the top ones that I know of. But these are helpful because people come back and they like the reviews and they pass. So it all just depends on you. Miss G, I see you out there. Here we go. Question number 7. The client with a cervical fracture is placed in traction. Which type of traction will be utilized at the time of discharge? Is it a Russell's traction, a Buck's traction, halo traction, or Crutchfield tongue traction? What are we thinking? What are we thinking? Who just gave me that hand heart? Miss G, thank you for the hand heart. I appreciate you. I appreciate it. Thank you. Hey, if you guys are just now joining, we are doing NCLEX questions from nurseslabs.com. They are free sets of questions. Samantha, thank you for the rose. I appreciate it. Everybody's telling me C. Okay. Hey, shout out to everybody over here on Instagram. Like I said, we are doing NCLEX questions. These are both for RNs and LPNs. All right. RNs and LPNs. All right. So make sure you guys participate over there. All right. Make sure you guys participate. Get your learn on. There's never enough that you can't learn. All right. Here we go. It says, would I be able to present yes. Is it Ashanti? I want to be your chick. I'm sorry. I'm sorry. I couldn't help with your name, but yes, it does help with LPNs. It does help both for RNs and LPNs. But the answer is C. It is halo traction. Halo traction will be ordered for the client with a cervical fracture. Halo gravity traction is a way to pull the head and spine upward, carefully applying a slow stretch to the spine. All right. It says, thank you kindly. Okay, I got you. What is your best grade? So my best grade that I got in school was probably like a 92, Luna. So it says got my RN letter to test yesterday. Shout out to you, Sherry. All right. So doctors do this by attaching a halo, which is a metal ring that surrounds the head, to a pulley system. Over several weeks, weights are added to the pulley system to slowly pull the head upward. This pulling is called traction, right? Kids stay in the hospital during halo gravity traction. That is safety and infection control. All right. Safety and infection control on the NCLEX. It says these seem harder. Hey, so remember, everybody's education level is different. Some people just opened their mouth today and said that they wanted to be a nurse. Other people have been nurses for 30, 40 years, right? So this is just a broad aspect of these questions. And if you don't know them, that's okay. That's the whole point of getting your learn on. All right. I'm at 10K. Yes. All right. Now we're going to 20. Make it happen. And Gel, it is your sole responsibility to make sure it happens. By the way, y'all, if we don't hit our next goal of likes, we're going to ban Gel. Okay. Can we all agree with that? We can all agree with that? Cool. So it'll be her fault. So we'll have somebody to blame. I'm just kidding. I'm just kidding. But it is halo traction, safety, and infection control. All right. So shout out to everybody that got that right. Gel, I'm just playing. I'm just joking. These are just jokes. All right. All right. Here we go. Question number 8. A client with a total knee replacement has a continuous passive motion device applied during the post-operative period. Which statement made by the nurse indicates an understanding of the CPM machine? So, what did the client say that shows that they understood the teachings with regards to this device that's been applied to them? All right. Use of the CPM will permit the client to ambulate during therapy. The CPM machine controls should be positioned distal to the site. If the client complains of pain during therapy, I will turn off the machine and call the doctor. Or is it D, use of the CPM machine will alleviate the need for physical therapy after the client is discharged? What are we thinking? It says, I plan to go to Galen for BSN in the fall, and this is super informative. I'm a patient care tech. Shout out, is it Shawnee B? Shout out to you. Shout out to you. Hey, if this is helpful for you, smash that like button. You know what I'm saying? Hey, if you're on Instagram and if this is helpful for you too, y'all can smash that like button. You know what I'm saying? I appreciate y'all. All right, let's see what the answer is. Let us see what the answer is in 3, 2, and the answer is B. The CPM machine control should be positioned distal to the site. The controller for the continuous passive motion device should be placed away from the client. Many clients complain of pain while having treatment with the CPM, so they might turn off the machine. The CPM flexes and extends the leg. CPM is a therapy in which a machine is used to move a joint without the patient having to exert any effort. All right, that is part of physiological adaptation, which is the third largest section on NCLEX. All right, at 11 to 17%. All right. Hey, remember, management of care, pharmacology, physiological adaptation, reduction of risk potential, they make up more than 50% of the whole exam. There's 8 client needs sections, and those 4 make up more than half. Just saying. All right. So make sure you guys understand that distal to the site, meaning away from the site. All right. So shout out to everybody that got that question right. Sandy Bay, is it Sandy Bay? Appreciate the heart me. Thank you. Appreciate all the likes too, y'all. All right, here we go. Question number 9. A client with a fractured hip is being taught correct use of the walker. No idea why I started stuttering like that. The nurse is aware that the correct use of the walker is achieved if the what? All right. Is it palms rest lightly on the handles? Elbows are flexed at 0 degrees. Client walks to the front of the walker, or the client carries the walker. Now, remember that from that section, crutches, canes, and walkers, right? How do we use them properly? How do we teach the client how to use them properly? Okay. My man, Jay Crow, I appreciate you, brother. Thank you. Hey, shout out to everybody that's here rocking. We're doing NCLEX questions. All right. I got them off of nurseslabs.com. They are free sets of questions. So if you don't want to be here on live with me, you can go over there by yourself, whatever you want to do, or y'all can hang out here with me, whichever. All right. I want to know who you are, where you're from, and where you're at in your nursing journey. All right. Fun little facts about me. I have been in the Navy. I'm sorry, I have not been in the Navy. I've been out of the Navy for a couple of months. I was actually in the Navy for 16 years. I've been a nurse for almost 4 years. And I failed my NCLEX 3 times. All right, but our answer is A. All right, our answer is A. Palms rest lightly on the handles. The client's palms rest lightly on the handles. The elbow should be flexed no more than 30 degrees, but should not be extended. Once a model of the walker has been selected, the fit of the walker becomes important. When holding onto the walker, the elbow should be bent in a position that feels comfortable and natural. Okay, the top of the walker should be even with the crease on the upside of the elbow when the arms are relaxed at the side. That's part of safety and infection control. All right, safety and infection control. Smaller section on NCLEX, but very, very much important. Make sure you guys understand what this question is asking you. All right, and shout out to everybody that got that right. What's up, Kate? I see you over there. It says hello from McAllen, Texas. A student, a VN student about to finish MedSurg 1. Shout out to you, Joanna. Shout out to you. All right, here we go. Question number 10. When assessing a laboring client, the nurse finds a prolapse cord. Okay, now just paint the picture of where we are. Shout out to the Philippines. I see y'all. The nurse should what? Attempt to replace the cord, place the client on her left side, evaluate the client's hips, or cover the cord with a dry, sterile gauze. What are we thinking? By the way, y'all, I failed my NCLEX 3 times. I failed my nursing exam 3 times. I passed on the 4th, and I don't care. And by me saying I don't care what y'all got to say about that, because not one of you have ever walked a day in my shoes and have never understood what I have personally going on. And guess what? Your job will never care and your patient will never care because they'll never ask you. All right. You have to get out of your own way just like I did. That happened to a friend of mine. Exactly. You see what I'm saying? What else are we thinking? I'm telling y'all right now. This test right here does not determine the type of nurse that you will be. Only you will determine that. Only you will determine the type of nurse that you will be. All right. So are you going to let this test get the best of you if you are unsuccessful? Or are you going to figure out what you messed up on? Are you going to audit yourself? And are you going to improve accordingly? I'm just letting you know. All right. And if you don't feel like you got anybody to talk to about that and you need a mentor, I'm everybody's mentor up in here. But anyways, the answer is C, elevate the client's hips. Okay, now let us see why. Let's see why. The client with a prolapse cord should be treated by elevating the hips and covering the cord with a moist, sterile saline gauze. The nurse should use her fingers to push up on the presenting part into a cesarean section can be performed. Cesarean section should be performed before rupture of the membrane or the cord would slide down the vagina. All right. So shout out to y'all for getting it right. That's part of physiological adaptation. That's part of actually another portion that's part of maternity, right? Mother baby, physiological adaptation. That's why it's the third largest section, because they talk about medical emergencies. All right. Medical emergencies. But that's the third largest section on the NCLEX at 11 to 17%. So shout out to everybody who got this right. Who is going on down here? Your mom? What? My mom? What? What happened to my mom? It says, what if they revoke the job offer because you didn't pass the NCLEX? Hey, you know what's crazy, your mom? I'm going to elaborate on that real quick. Hey, real quick, y'all. I have an ebook. I call it the NCLEX Victory Guide. It's over 700 pages of all just buttery, delicious goodness that you need to know for the NCLEX. You want to know why? Because the path to conquering the NCLEX begins with you. Remember, I failed my NCLEX. And when I failed my NCLEX, the only person I can blame was me. My lack of time management, my lack of accountability, my lack of attentiveness to this exam, worried about what other people had to say. And then once you get control of your life and you realize that it's only going to be you, and you alone taking this exam, studying for this exam starts to become a lot easier. All right. So you guys can go check that out at thebootnurse.com/victory, or you guys can go look at the link in my bio. OK, and that'll take you to the book as well. But like I said, it goes over pharmacology. We got EKG interpretations. What else is in there? Management, delegation, supervision type of questions, all kinds of stuff in there. So you guys can go over there and check that out. And that link is in my bio. But to answer your question, y'all can go ahead and y'all can read this one, because I'm going to answer your mom's question. Let me tell you something. If they revoke your job because you don't get a license, guess what? That's okay. It's not like you can't get another job around here. All right. Put it this way. You can't get the job anyway if you don't have a license. So guess what? You could tell people, hey, yeah, I'm taking my exam. But guess what? If you don't have a license, you can't work. So most important thing is to get your license. That is what the important thing is, to get a license so you can get a job. Guess what? They do job fairs every month in almost all areas. Every hospital does a job fair every month to every quarter. So trust me, listen, they need nurses out here. So trust and believe me, where one door closes, another one shall open. All right. But if you guys are new here, welcome. I'm off my soapbox now. But if you guys are new here, rocking, appreciate you being here. We are doing NCLEX questions. I just got a job offer and it starts June for the NICU. Okay. So you got a job offer. So what does that tell you? You need to get in gear. All right. You need to get in gear. All right. And you know what else we're going to normalize? We're going to normalize getting to 150 questions. Okay. I don't know where this whole thought process came from, people that said, hey, you only want to get 85 questions. No. My mom is here. Hey, SSH Mentoring. Sarah, I love you. Thank you so much for being a great person. All right. Hey, but the answer is A, it is report muscle weakness to the physician. All right. So that's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam. I'm telling you right now, pharmacology, you better know it. You better know it. You better not come out here into this nursing world and not know your pharmacology. All right. Remember, this is just, you need to know the basics of what's happening with your medications. Rhabdomyolysis. There you go. Rhabdomyolysis. Sorry. So y'all need to understand what these medications do. The last thing that you want is to be out here giving somebody vecuronium when you meant to give them Versed. I'm trying to tell you, you better understand what these medications do to these patients. Because, hey, it doesn't matter if you mess up. The board will pull that license. Trust and believe me. All right. They will pull that license. So you guys have got to understand pharmacology. All right. So shout out to everybody that got that right. If you got it wrong, circle back and keep studying. All right. So here we go. Question number 12. The client is admitted to the hospital with hypertensive crisis. Hyperstat is ordered. All right. During administration, the nurse should what? Utilize an infusion pump. Check the blood pressure, check the blood glucose level, place the client in Trendelenburg position, or cover the solution with foil. What are we thinking? Shout out to all 111 of y'all out here rocking. We're doing NCLEX questions. I appreciate y'all being here on this Friday. Y'all could have been anywhere else, but you're here with me, and I appreciate you getting your learn on. All right. And if you guys are new here, make sure you guys smash the like button, you guys share, and you guys follow #Redonda. You already know what's up. Over here on Instagram, who is that? Adore. Yeah, you know what's up. #Redonda. Yeah, if there's anything that y'all better pay attention to, y'all want to pay attention to the mistakes that she made, and you do not want to make them. Do you go live every day? I don't. I go live every Monday, Wednesday, Friday at 5:30 on TikTok. I'm probably going to start doing the same thing on Instagram as well. All right. But the answer is B. We want to check the blood glucose levels. Hyperstat is given as an IV push for hypertensive crisis, but it often causes hyperglycemia. The glucose level will drop rapidly, then stop. This medication is used to treat very low blood sugar. All right. So certain conditions such as a tumor on the pancreas, cancer, leucine sensitivity can cause the release of too much insulin. Insulin is a natural substance that lowers blood sugar. This drug works by preventing insulin release from the pancreas, helping to return the blood sugar to normal levels. All right, that is part of pharmacological and parenteral therapies. Second largest section on the NCLEX at 13 to 19%. If I did not say that before, but 13 to 19%. I'm trying to tell you, I'm trying to tell you, pharmacology, y'all better know it. Y'all better know it. Y'all better live it. Y'all better love it. All right, here we go. Question number 13. A 6-month-old client with a ventricular septal defect is receiving digitalis for regulation of his heart rate, which findings should be reported to the doctor. Now we're talking about congenital heart diseases. Now we're talking about digitalis, which is a cardiac medication. Right? So what should be reported to the physician? Meaning what's happening based off of my answer choices that require me to report it to somebody, meaning something is bad. So is it the blood pressure is 126/80, glucose is 110, heart rate is 60, or the respiratory rate is 30. What are we thinking? Oh, Samantha, I see you out there. The heart rate is too low. Boom, it's C. Okay, Joy, I see you out there. Samantha, I need for you to be on band duty. This is way too low. Okay, Rose. All right, what else are we thinking? Instagram, what y'all think? They Adore says D. Or now you're saying C? Okay, which one, Adore? You got to give me one. You got to give me one. All right, hey y'all, how y'all doing? We're doing NCLEX questions both for RNs and LPNs. I got them off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out. C is okay. Well, let's see what what the answer is. Oh, all right, I'm done. Here we go. And the answer indeed is C, the heart rate of 60 beats per minute. All right. So a heart rate of 60 in the baby should be reported immediately. Right? Immediately. The dose should be held if the heart rate is below 100 beats per minute. Why? Because they're a baby and babies have fast heart rates, right? Digoxin has vasomimetic effects on the AV node. By stimulating the parasympathetic nervous system, it slows electrical conductions in the atrioventricular node, therefore decreasing the heart rate. The rise in calcium levels leads to prolongation of phase 4 and phase 0 of the cardiac action potential, thus increases the refractory period of the AV node. Slower conduction through the AV node carries a decreased ventricular response. We're talking about DIG. It's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 13 to 19%. You need to understand with cardiac meds, regardless, you better be taking vital signs. You better be taking vital signs before you give any type of cardiac medication. And if their vital signs are too low, or if they're too high, or if they're ineffective, you might want to hold them. All right. You need to understand when to give them, when to hold them, and when to report them. Okay. So make sure you guys understand that. All right. Here we go. Question number 14. A client admitted with angina is given a prescription for nitroglycerin. I can only imagine where this question falls under. The client should be instructed to what? Replenish his supply every 3 months, take one every 15 minutes if pain occurs, leave the medication in a brown bottle, or crush the medication and take with water. What are we thinking? Hey, remember, we're in full swing. Hey, we're in March. So first of all, shout out to everybody that's about to be graduating here in May. All that hard work that you guys put in, it's coming to fruition. All right. That long journey of endurance of you going through nursing school is finally about to come to an end. So I'm going to tell you guys an early congratulations. But ladies and gentlemen, you are not done yet. You are not done. All right. You can see the finish line, but the true finish line is getting that license. OK. So you have to continue to push through the finish line. Don't stop. Hey, don't try to be like, what's that girl name? Shakira Richardson, where she started looking at the crowd and started pumping her chest. No, let's not do that. You know what I'm saying? Speak it into existence. All right. Put it out into the universe and the universe will give it back to you. All right. And I'm telling you, as a person who literally went to the testing center 3 times and was just like, fuck it. If I do it, if I make it, I make it. If I don't, oh, well. To the 4th time where I was just like, oh, no, I'm passing this exam. You see what I'm saying? Speak it into existence. Claim it right now. I want everybody right now, as you are answering, I want you to claim it right now. Claim it. All right. But the answer is C. Leave the medication in the brown bottle. Nitroglycerin should be kept in the brown bottle or even in special air and watertight, solid, or plated silver or gold containers because of its instability and tendency to become less potent when exposed to air, light, or water. All right. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. I know that's right. Claim it. Claiming it. I will pass. I know that's right. I'm claiming it in the name of Jesus. That's what I'm talking about. Claim it in the name of Jesus, the name of Allah, whatever religious being that you worship, claim it. Claim it. But you got to realize as you are claiming it, you are putting in the work to get it. All right. As you are claiming it, you are putting in the work to get it. So shout out to everybody. Hey, I want you to claim it every day. I want you to write it on a sticky note and put it on your door, put it in your bathroom, put it in your shower. I don't know. You know what I mean? Claim it. Claiming it. That's what I want to hear. Question 15. The client is instructed regarding foods that are low in fat and cholesterol. Which diet selection is lowest in saturated fats? Is it macaroni and cheese at 3 o'clock in the morning? I'm sorry. Is it shrimp with rice? Is it turkey breast or is it spaghetti? What are we thinking? It says claiming the NCLEX passing summer 25. That's what I'm talking about. Adore. That's what I'm talking about. Claiming it around here. Shout out to everybody here who is rocking. We are doing NCLEX questions from nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. But if you are new here, I want to know who you are, where you're from, and where you were at in your nursing journey. And if you're not a nurse, what are you doing here rocking out with us, getting your learn on this Friday? All right, y'all, here we go. Here's our answer in 3, 2, and the answer is C. It's turkey breast. I was about to say turkey bacon, mostly because that's kind of what I feel like eating right now. But shout out to turkey breasts, right? So turkey contains the least amount of fat and cholesterol. Both turkey and chicken are rich in high quality protein. Chicken breast has slightly more protein than turkey breast, but turkey thigh, gotta love a turkey thigh, is minimally higher in protein than chicken thigh, right? The other meat cuts provide equal amounts of protein. That's part of basic care and comfort. That's something that you learn in foundations and fundamentals. You see what I'm saying? It says, if you are not tapping, you're napping. Let them know, Kim. It says, I signed my job or offer acceptance letter today. Kathleen, I love that for you. I love that you signed that letter. However, even though you signed that letter, you still got work to put in. All right. You still got work to put in. And ladies and gentlemen, to continue putting in that work, I have an NCLEX course where I have over 70 videos to include 2 sets of NCLEX reviews, as well as NCLEX content, important NCLEX content that is there to help you pass the NCLEX. You can join it. It's called the 7-day NCLEX course, and you get a community where I actually go live and I do lectures, as well as I break down more NCLEX style types of questions over a specific period of time. And you can join that right now for $7. $7. That's $1 more than 6 and 1 less than 8. $7 for 7 days. And if you like it, cool. You know, and then it goes into a subscription base. You know what I'm saying? If I join, don't you be yelling at me. Look, first of all, I will yell at you. There's no ifs, ands, or buts about that. Specifically you. But no, we have a good time over there. I had a couple people that did my live with me yesterday, and we went over a bunch of questions. And hey, we go back and forth. I ask you, do you understand what I'm talking about? You know, does that sound familiar? Just saying. Go over there and check it out, thebootnurse.com/special, or you guys can check that link out up in my link tree on my main page, okay? But the answer is B. You like yelling? Kelly, stop it. All right, but the answer is B. It is, it's neck. Wait, did we even read this? Did we read this? Oh, wait, I don't even know what's happening here. Oops. We won't even worry about that. I forgot where the question was. My bad. Here we go. So question 17, the nurse is checking the client's central venous pressure. The nurse should place the 0 of the manometer at what, or at the where? So where am I placing the manometer, right? Is it the phlebostatic axis, the PMI, the Erb's point, or the tail of Spence? Hey Kim, don't yell, don't laugh at me, okay? I'm working on some things right now. I'm working on some things. All right, y'all, what are we thinking? I'll give you guys 15 seconds. It says love plus appreciation from Canada. Shout out to you, Rose. It says working part-time as a healthcare administrator, I'm a guess, or assistant, I'm sorry. And in my second semester of LPN, shout out to you, Rose. Rose, you will conquer. You will conquer. Hey, everybody on Instagram, you will conquer. Trust and believe that. All right. Let us see what the answer is. Here we go in 3, 2, and the answer is A. It's the phlebostatic axis, right? The phlebostatic axis is located at the 5th intercostal space mid-axillary line and is the correct placement for the manometer. Phlebostatic axis is a point located by drawing an imaginary line from the 4th intercostal space at the sternum and finding its intersection with an imaginary line drawn down the center of the chest below the axilla. All right, that's part of reduction of risk potential. This is something that is used when you're using an arterial line. So some of you may not know this, right? This may be a little bit of a harder question. Now I don't know. What do you mean? That's okay if you don't know. What do you mean you don't know? That's okay. So usually, like I said, this is something that is used when you're doing an A line. So for those that are going to be going to critical care and you guys are doing A lines and you guys are trying to zero out the A lines to get accurate blood pressures and maps, this is what you're going to know, right? This would be a hard question that they would break out, especially if you didn't know it. All right. So just be ready for that. Remember, I worked critical care for a year and like 3 months. All right. Hey, A lines. They're amazing. All right, here we go. Question number 8. The physician orders lisinopril and furosemide, all right, to administer, commitmentally. Who writes that? I'm just going to say that given at the same time to the client with hypertension. There. How about that? The nurse should what? Question the order, administer the medications, administer separately, or call the pharmacy. What are we thinking? First of all, what is lisinopril? And what is furosemide? This is part pharmacology, right? What is lisinopril? An ACE inhibitor. Got you. An ACE inhibitor. I'm just playing. Water pill. No, I need to know what it is. What is a water pill? Like, am I retaining water? Am I getting rid of water? Stephanie, I'm just playing. Hypertension medication, right? So it is a ACE inhibitor. So is it a cardiac medication, right? Furosemide. Is it a K wasting or a K sparing diuretic, right? Yeah. Pulls fluid out of the body, polyuria, I'm about to say diarrhea, diuretic. I got you, William. I got you. K wasting, right? There we go. All right. So now what's most important? Can these be given at the same time? Do I administer them separately? Is something wrong where I got to call the pharmacy? Or do I question this order altogether? All right. Hyperkalemia, yes. All right, well, let's see what the answer is. ACE inhibitor, I see you, Adore. Here we go. Here's our answer in 3, 2. And the answer is to administer the medication. All right. Zestril is an ACE inhibitor and is frequently given with a diuretic such as Lasix for hypertension. Studies of hypertension confirm that ACE inhibitors enhance the antihypertensive effect of diuretics, though the interaction appears more additive than synergistic. Combining diuretics with ACE inhibitors appear to be no more effective than combining them with beta blockers. Once again, that is pharmacological and parenteral therapies. All right, pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. Ladies and gentlemen, never, ever, 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 ever be afraid to question an order about medications that you are not familiar with. Never be ashamed about it. If you have to pull your phone out and look on Hippocrates or Up to Date or whatever other type of medications that talk about how to give them and drug interactions with other medications, that is okay. That is what a smart nurse would do. And that is what all of you are. Every single one of you. It says you only question when furosemide with digoxin. Look at you, Chella. Look at you, smarty pants. So once again, if you got it right, read it and see why it's right. And if you got it wrong, read why it's right and then read why your answer is incorrect. And then you circle back. OK, but listen to me. Pharmacology is important, ladies and gentlemen, and you have to know it. I will say it until I'm blue in the face and I'm black as shit. So I'm just letting y'all know. All right. RTFQ. You know what the deal is. RTFQ. All right. And lithium. There you go. Lithium has a narrow therapeutic window. Right. So, and what does lithium do, Chella? Let them know. Question 19. The best method of evaluating the amount of peripheral edema is what? Weighing the patient or weighing the client daily, measuring the extremities, measuring the intake and output, or checking for pitting. What are we thinking? Adore over here on Instagram. Are you saying B for this current question right here? Tatiana's telling me A. Your mom. Oh, now you're telling me D. So you say checking for pitting. I just want to make sure. Jell is telling me. I don't care. Kelly's telling me D. Okay, cool. Kaylin is telling me A. Shayla. Crystal. I know a Crystal Martin. Shout out to all 146 y'all. We are doing NCLEX questions. I got them off of nurseslab.com. They are free sets of questions. Make sure you guys go over there and check them out for yourself. Definitely A. Well, it's definitely B. So there is our answer. Yep, B was for the previous. Okay, I'm tracking. I got you. Anyways, so here, the answer is B. Well, let us find out, okay? Let us find out. Ashanti, how long are you on live? Are you taking for us now? I'm totally lost. What? Huh? I'm confused, Ashanti. The best indicator of peripheral edema is measuring the extremities. A paper tape measure should be used rather than one of plastic or cloth, and the area should be marked with a pen, providing the most objective assessment. The circumferential method is one of the girth measurement techniques. For consistent measurements, upper extremities or lower extremities is marked with a semi-permanent marker at a certain part with reference to the bony prominences. That's part of physiological adaptation. Physiological adaptations, which is the third largest section on the NCLEX exam. All right. Third largest section on the NCLEX exam at 11 to 17%. Is that if the patient has, it didn't say anything. It said nothing about deep vein thrombosis. None whatsoever. None whatsoever. Now, is that way to check for swelling? Now, you got to think about it. What does the DVT do? It's a clot that's starting, it usually starts at the lower extremity and it works its way up. Now you're going to start to see swelling and they're going to start having pain. That's going to start radiating, but that's not what this question is asking us. Redness, there you go. That's not what this question is asking us. It's talking about peripheral edema. What disease process can you think of right off the top of your head that would coincide with peripheral edema? And I mean swelling in the legs. So that means we're retaining water. CHF. There you go. CHF is definitely the correct answer. Your heart failure. Yes. Yes. Shout out to y'all. That's what I'm talking about. See, y'all smart out here. You know what I'm saying? I don't care what nobody say on anybody else's channel about all 150 of y'all. I'll just play it. But yes, that's exactly what we're talking about, right? CHF. There you go, Adore. Question number 20. A client with vaginal cancer is being treated with a radioactive vaginal implant. The client's husband asked the nurse if he can spend the night with his wife. The nurse should explain that what? So overnight stays by family members is against hospital policy. There is no need for him to stay because staffing is adequate. His wife will rest much better knowing that he is at home, and visitation is limited to 30 minutes when the implant is in place. What are we thinking? What are we thinking? Shout out to all 200 plus of y'all. We are doing NCLEX questions off of nurseslabs.com. They are free sets of questions. I need for you to smash that like button. Hey, 30,000 likes. Smash that like button. I need for you to share and I need for you to follow. If you're in nursing school right now, listen, I don't care if Becky with the good hair, you don't like her. I might like her. I might like her. You know what I'm saying? Bring her over here. You know what I'm saying? If y'all want to beef in the chat, y'all can do that too. But I need her over here. You know what I'm saying? But if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. It says, passed my NCLEX almost 3 years ago. This is giving me flashbacks. Aubrey, I bet it is. I passed my NCLEX in 2020. It gives me flashbacks at least daily because that's all I do is NCLEX stuff. I'm in block 2. No idea what that means. No idea. You got to elaborate for me. All right, y'all, here we go. Here's our answer. What's up, Queen? How are you? And our answer is D. Visitation is limited to 30 minutes when the implant is in place. Clients with radium implants should have close contact limited to 30 minutes per visit. The general rule is limiting time spent exposed to radium, putting distance between people and the radium source, and using lead to shield against the radium. Teaching the family members these principles is extremely important. Internal radiation therapy uses a pill, liquid, implant, or temporary source to put radiation inside the body to kill the cancer cells, and may require certain safety precautions for staff and family while the patient is in the hospital or at home, according to the National Cancer Institute. That is part of reduction of risk potential, which is 9 to 15% on the NCLEX, the fourth largest section on the NCLEX exam. About to take my T's, any advice? If you're talking about the entrance, I don't know nothing about that. I never took an ATI T's. And if you're talking about the T's, like while you're in school, like ATI T's, exit exams, know nothing about that either. Opinions on the comp predictor? No idea. I've never done anything ATI. But from everybody that I hear, it's trash. If you guys follow Nurse Glamber or Nurse Amber, she's an NCLEX strategist. She's one of the homies, right? And she does not like ATI. It's terrible. I had Hesse, and Hesse is also terrible. Sorry, I don't care. I'll let you guys know. But ladies and gentlemen, I actually do coaching and mentoring where I work with you one-on-one. And when we work one-on-one, especially for those that are afraid to keep going, are scared, don't know where to start, lack accountability, need help breaking down questions, need help understanding content, all that good stuff. I do that for you. And I do that with coaching and mentoring. I've actually been coaching since I got a license because I use my teaching background. And I have a 100% pass rate. Every single person that I've ever coached has passed their NCLEX. I'm just letting you know. Why? Because you get that one-on-one attention, right? And it's with me. So if anybody is interested with that and you need help and you want to accomplish this goal of getting a license and going out there taking care of patients and then, getting that bag, but we take care of patients first. Check me out, thebootnurse.com/coaching, fill out the questionnaire, book a call with me, and let's see if coaching's right for you. All right. It says, does it cost? Of course it costs. Of course it costs. And everybody's cost is different. Why everybody's cost is different? Because some people need more, some people need less. I have 100% pass rate tutoring too. My sister and my daughter-in-law, 2 and 2. Shout out to you, Nurse Shark. Here we go. Question number 21. The nurse is care. That's not fair, by the way. Well, no, that is that's actually fair. I mean, you're the nurse. They came in, they wanted to be nurses. So, I mean, why not get the direct information from you, right? So that makes sense. It says, awesome. I'll keep you in mind when I'm ready to take my NCLEX. Elizabeth, I love that. Here we go. Question number 21. The nurse is caring for a client hospitalized with a facial stroke. Which diet selection would be suited for this client? All right. Is it a roast beef sandwich, potato chips, sheared, or pickle shears and iced tea? Is it split pea soup, mashed potatoes, pudding and milk, tomato soup, cheese toast, jello and coffee, or a hamburger, baked beans, fruit cup, and iced tea? And by iced tea, I don't mean the rapper / Mr. Law and Order. But what are we thinking? Shout out to all 288 of y'all rocking. We're doing NCLEX questions over here on Instagram. Adore, I see you hanging out. What do we think the answer is? What do we think that answer is? Soft foods. Jay Quellen, you correct. We got to have some type of soft foods, right? Soft diet. Is it Mimil? It says, I'll definitely tutor you. I'll definitely tutor to you when my son's girlfriend needs to study for NCLEX. No caffeine. Glad I found you. I'm glad you found me too. Welcome, everybody. Welcome. All right, y'all. Let's see what the answer is. Let us see what the answer is in 3, 2. And the answer is B. It is B. It says could be C, though. It said it could be C. Thinking Bell's palsy. We're not talking about Bell's palsy. We are talking about stroke. Well, I see what you're saying. Never mind. I see what you're saying. I had to think about that. But yeah, we are just talking about facial, right? So here we go. The client with a facial stroke will have difficulty swallowing and chewing. So everybody that says soft diet, you're very correct. These food items mentioned provide the least amount of chewing. All right. Basic care and comfort, 6 to 12% on the NCLEX exam. So straight to the point, you're right. It says, I need a tutor for Farm 2. Well, Cristal, like the champagne, I only tutor people with regards to NCLEX. I only tutor people with regards to the NCLEX. However, I do have a friend. Her name is Nurse C, and she does dosage calculations where she does nothing but pharmacology. I would recommend going to follow her. She does dosage calculations damn near almost every day. And let me tell you something right now. That lady's smart with the numbers. So I would definitely go over there and check her out. Okay. It's her tag is a blessed RN. I can't type it in here for some reason, but if y'all know what I'm talking about, y'all type it in there and I'll pin it. All right. Here we go. Question number 22. The physician has ordered Novolog insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? This is guaranteed an NCLEX type of question. All right. You need to know when the onset, the peak, and the duration of certain insulins are. Okay. You just have to. So is it A, I will make sure I eat breakfast within 10 minutes of taking my insulin. I will need to carry candy or some form of sugar with me at all times. I will eat a snack around 3 o'clock each afternoon. I can save my dessert from supper for a bedtime snack. What are we thinking? Advice for accelerated students. It's so fast paced and really want to pass this exam. So Jackie, I was in an accelerator program. I did a BSN program in 18 months. I have some friends that went to UT Arlington and it was 15 months. It's very doable. One thing I would recommend is finding a group. Like I was in a group. It was me and 3 other women. And I'm telling you right now, we would not have made it without each other because it's so fast and it's so much information, right? And guess what? If you decide to be in a group and people aren't pulling their weight, get rid of that ass and bring in somebody who's going to pull in their weight. That's how you trim the fat. Everybody needs to be out here working. So, but the answer is A. I will make sure I eat breakfast within 10 minutes of taking my insulin. Novolog insulin's onset is very quick. So food should be available within 10 to 15 minutes of taking the insulin. This is very important, ladies and gentlemen, when you are working the floor. It doesn't matter if you're working med-surg. It doesn't matter if you're working ICU. It doesn't matter if you're working PACU. If you know that this patient has diabetes and they have to get some type of insulin, you better have the food ready for them. You better have it ready. especially if the onset of it is 10 to 15 minutes. All right. So that is part of pharmacological and parenteral therapies. Pharmacological and parenteral therapies, which is 13 to 19% on the NCLEX exam. It is the second largest section on the NCLEX exam. I'm gonna beat it into y'all, not physically, but verbally, that you need to understand. You need to understand your pharmacology. All right. So shout out to y'all. All right, here we go. Question number 23. The nurse is teaching basic infant care to a group of first-time parents. The nurse should explain that a sponge bath is recommended for the first 2 weeks of life because why? So why would we recommend a sponge bath to a baby who's been in this world for, I don't know, 2 weeks? So is it A, new parents need time to learn how to hold the baby? Is it B, the umbilical cord needs time to separate? C, newborn skin is easily traumatized by washing? Or is it D, the chance of chilling the child's or chilling the baby's weight? The chances the chance of chilling the baby outweighs the benefits of bathing. Lord have mercy. I do not know how to read. Adore is telling me that she's telling me B. Okay. People standing on business is telling me C. Okay. Get it together. First of all, I'm about to mute you. You want to get muted? You finna get muted. Finna. Finna. All right. All right, y'all. Here we go. Let's see what our answer is. Here's our answer in 3, 2, and the answer is B. The answer is B. All right, the umbilical cord needs time to separate. The umbilical cord needs time to dry and fall off before putting the infant in the tub. The first bath will be a sponge bath. Pick a warm room with a flat surface like a bathroom or kitchen counter, a changing table, or a bed. Cover the surface with a thick towel. Make sure the room temperature is at least 75 degrees Fahrenheit because babies chill easily. That's part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right, 6 to 12%. Hey, y'all, don't be like me. You know what I'm saying? When my son was born, you know what I'm saying? And I'm just like, hey, we'll give him a bath. And then he get mad at me. You know, he's probably like, I don't know, 100. He's like 96 hours old and he's looking at me like I'm crazy. I'm just playing. No, but it was wild when we brought him home. I'm not gonna lie to you. Here we go. It says, I can't wait to be done. School is so stressful. I'm studying for my exit right now. Hey, Darlie, love Darlie. You're good. You got it. You got this. I'm using Archer, UWorld, Saunders, and whoa, you are using way too much. You're using Archer and UWorld. You don't need both. You need one. You are using way too much. So I would recommend you need to just use either Archer or UWorld, pick one, and then use the Saunders book, and then maybe your best grade. But you do not need both Archer and UWorld. They are both literally the same type of thing. All right, here we go. The question number 24. A client with leukemia is taking trimextrix. I'm sorry, I'm trying to read the comments, but after reviewing the client's chart, the physician orders Wilcoverin. All right, the rationale for administering leucovorin calcium to a client receiving trimextrate is what? Is it to treat iron deficiency anemia caused by chemotherapeutic agents? Is it to create a synergistic effect that shortens treatment time, increase the number of circulating neutrophils, or reverse drug toxicity and prevent tissue damage? What are we thinking? But yes, ma'am, you are using a lot. You're using way too many resources. All right. Hey, if you're over there on Instagram, shout out to you. Appreciate you being here. We're doing NCLEX questions. I want to know both on Instagram and TikTok where you are, where you're from, where you're at in your nursing journey. A little bit about me. If you're new here, I've been a nurse almost 4 years. I worked ICU, specifically a burn ICU and a medical ICU. I worked PACU and I worked in the operating room. So shout out to y'all. It says, just took my NCLEX. Lacey just says, just took my NCLEX and shot off at 85 and I passed. Shout out to Louisiana. Ma'am, Lacey, welcome to the greatest shit show on earth known as being a nurse. Congratulations to you. If there's a piece of advice that you could give to anybody or everybody in here about taking the exam, what would it be? What information would that be? And once again, ma'am, congratulations to you. All that hard work finally paid off. So congratulations to you. Shout out to Kentucky. All right. It says, what grade should I be getting on UWorld before I take the NCLEX? So you really need to be scoring higher. Like the chances of you, the higher the score, the better. So if you're scoring in the 60s and the 70s, you're looking really, really hot. Hell, but I've seen people score in the mid to low 50s and still pass, right? You got to get a hold. You have got to get a hold of that anxiety and to not let it control you. All right. But the answer is D. It is reverse drug toxicity and to prevent tissue damage. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 13 to 19%. Now, it may be the second, but I'm telling you, it is by far the hardest. I'm trying to tell you because there's so many drugs with side effects, right? And then you got to understand the safety implications of when to give them and when not to give them. And you need to know what the expected and the unexpected outcome is of giving these medications. And if it's unexpected, what do we do at that point? Archer or UWorld? It doesn't matter, to be honest. It really doesn't matter. Me personally, Kenny, Kevin likes Archer. I don't like UWorld. But if you were to talk to Nurse Amber or Nurse Glamber from Enhanced Nursing, who's one of the homies, she loves UWorld. But once again, it's all depending on you and how you use your tools, because it's proven that both of them work. I'm just saying. She says, like Lacey says, Archer. I like Archer, but Nurse Amber will tell you different. Other people will be like, hey, I swear by ATI. It's a low percentage, but it is. Question 25, a 4-month-old is brought to the Well Baby Clinic for immunizations. In addition to the DTaP and polio vaccine, the baby should receive what? Is it a Hib titer, mumps, a Hep B, or MMR? You're welcome, Kenny. No problem. Salute. Shout out to all 236 of y'all. Hey, by the way, y'all, if y'all are new here, give me the 30,000 likes. I'm about to tell y'all something right now. If you're new here and you never knew this, but I failed my NCLEX 3 times. Yeah, that's it. That's all I got to tell you. I failed my NCLEX 3 times. And I became a nurse. And I've been a nurse almost 4 years. And you want to know what's really funny? Is when I told people that I worked with that I failed my exam 3 times, they looked at me with such surprising faces as in like, are you serious? And I'm just like, yeah. Because I have no shame. None. I have no shame whatsoever. And they're just like, wow, I would have never guessed that. You're a great nurse. Exactly. Because it's what you do as a nurse that determines the type of nurse that you are and that you're going to be, not the exam. All right. So for those that are scared, that are nervous, first of all, if you're scared, go to church. Just saying. But guess what? You're going to do that scared anyway, too. So what I would recommend is that you get out of your own way. You have to get out of your own way. You are the only person who is impeding you from accomplishing your goal. Period. All right, here we go. And the answer is A. All right, now let us see. All right, so Haemophilus influenzae or influenza vaccine is given at 4 months with the polio vaccine. It protects the child from Hib disease, right? Which can cause a lifelong disability and be deadly. Protects the child from most common types of Hib's diseases, such as meningitis, right? Which we all know what meningitis is, which is the infection of the lining covering the brain and spinal cord, and keeps the child from missing school and childcare and the parents from missing work. First of all, that's probably one of the most solid rationales I've ever read. Like, I'm not even gonna lie to you. That last part is very irrelevant, but the very first part about it, preventing or protecting the child from meningitis, very, very, very important. All right. So just make sure you guys understand that that's part of health promotion and maintenance, which is 6 to 12% on the NCLEX. Ador's telling me I'm from Philadelphia. Will be a senior. It will be my senior year of nursing school in September. Shout out to you, Ador. Shout out to you and everybody over there on the gram. Ladies and gentlemen, in case you guys missed it. All right. Hey, I got a free download that you guys can check out. Hey, that's 42 pages minus the fanny pack because, y'all can't be taking the fanny pack, you know what I'm saying? But go over there and get it. It's a free download, 42 pages of tips on how to conquer the NCLEX. And I also have an ebook, over 700 pages. We go through EKGs, pharmacology, management of care types of questions, growth and development. Go over there and check that out, bootnurse.com/victory. And of course, if you're looking to join an NCLEX course, it's an on-demand NCLEX course, right? You can join it for $7. 7. How do you say 7 in Spanish? Siete, right? Oh, I had to count off my fingers. But y'all could go over there and y'all could check that out as well. You see what I'm saying? And also, if you're one of those individuals who needs help breaking down NCLEX style questions, you need the motivation and accountability, one-on-one mentoring, right? With how to conquer the NCLEX, you guys can check me out right there at thebootnurse.com/coaching. Seven Pacos or pesos. What are we talking about here? No, not 7 pesos. 7 American dollars. It's $7 and you get it for 7 days, and then it goes to a monthly subscription. All right, here we go. Question number 26. The physician has prescribed Nexium, all right, for a client with erosive gastritis. The nurse should administer the medication how or when? Is it 30 minutes before meals, with each meal, and a single dose at bedtime, or 30 minutes after meals? What are we thinking? It's crazy because every time I do a promo, I lose people, but that's okay. Smash that like button and get people up in here. Jill, what are you doing? What are you doing? Ador's telling me A for 30 minutes. I see you over there. All right. It says before the Zols. There you go. Before the Zols. Okay. I see you. I see you. Hey, that's a good way to remember it, right? That's a good way to remember it. Jill, you know what I mean. You know what I mean. Didn't I put you in charge of making sure people get carpal tunnel for me? Oh, you messing up. All right, y'all, here we go. Here we go. Here's our answer. Shameless, thank you for the follow. Appreciate you. And the answer is A. It's 30 minutes before meals. So what did you say? Before the Zols, right? It's a PPI. I know that much. Hey, look. Hey, you're one step closer, Kayla. One step closer. Proton pump inhibitors reduce the production of acid in the stomach. PPIs work best when they are taken 30 minutes before the first meal of the day. Take each dose with a full glass of water. I'm just going to say Nexium. I always mess it up. I'm not going to say it. Nexium is usually given for 4 to 8 weeks only. The doctor may recommend a second course of treatment if the client needs additional healing time. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. By the way, they will not say Nexium on the NCLEX. They will use the generic names. What is it? Esomeprazole? Yeah, esomeprazole. Here we go. Hey, the Zols, right? What did you say? Who said that? Lucky, you said something about the Zols. All right, so shout out to you. All right, but here we go. Hey, remember, if you got it right, circle back. If you got it wrong, keep doing the same thing and circle back. I like that, Lucky. I like that. The Zols, right? I like that. Here we go. Question number 27. Before the Zols, there we go. Question 27. A client on the psychiatric unit is in an uncontrolled rage and is threatening other staff or clients and staff. What is the most appropriate action for the nurse to take? Now, we're talking about psych. What is the most important thing? What is the most important thing that we need to do when we have somebody who's uncontrolled and who is a psychiatric patient? Safety, 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 safety. All right. So is it A, call security for assistance and prepare to sedate the client? Tell the client to calm down and ask him if he would like to play cards. Sure. Everybody likes to play a little Uno, right? Is it tell the client that if he continues his behavior, he will be punished, or leave the client alone until he calms down? What are we thinking? Hey, you're right. Safety, safety, safety. 100%. Somebody kept asking me about paramedics. I think it was Evan. Was it Evan that kept spamming that? Asking me about paramedics and stuff. I don't know if Evan's still here. How often do you do NCLEX reviews like this? So for nurseslabs.com types of questions, I do these 3 times a week. Now I'm actually working on doing a very in-depth NCLEX review. I'm working on that. You guys are going to, hey, I wasn't going to say nothing about that, but that's coming up real soon. It's going to be I'm probably going to do it twice in the month of April. So y'all keep coming. Y'all keep liking. Y'all keep sharing. Y'all keep following. And hey, that review is coming. That review is coming. But the answer is A, call security for assistance and prepare to sedate the patient. If the client is a threat to the staff and other clients, the nurse should call for help and prepare to administer medications such as haloperidol, right, to sedate him. Alert staff if a potential for seclusion appears imminent. Usual priorities of intervention would be firmly setting limits, chemical restraints such as tranquilizers, and seclusion. If nursing interventions such as quiet areas and firm limit settings and chemical restraints have not helped damper escalating manic behavior, then seclusion may be warranted. That's part of psychosocial integrity, which is 6 to 12% on the NCLEX, one of the lower sections, but of course, very, very much important. Remember, with psychosocial, you have to remember It is about safety and good therapeutic communication skills. Good therapeutic communication skills is a Barbe doll. Appreciate the follow. Thank you. What's up, E-Money? What's the deal? My man AJ, I see you over there. All right. Hey, remember, but with psych, good therapeutic communication skills. Never be demanding with psych. Absolutely. Carolina, what's up? How are you? Here we go. Question number 28. When the nurse checks the fundus. All right, now paint the picture. Where are we? When the nurse checks the fundus of a client on the first postpartum day, she notes that the fundus is firm and is at the level of the umbilicus, whatever, and is displaced to the right. The next action the nurse should take is to what? All right, so if my fundus is at the umbilicus and it's to the right where it's not supposed to be, what are we thinking? All right, so do we want to check the client for bladder distension, assess the blood pressure for hypotension, determine whether was it oxytocic, whatever drug, okay, was given, or is it a check for expulsion of small clots? What are we thinking? They have to go to the bathroom. You put it back. Definitely a bladder distension. E-Money, really? Where are we? I don't know. Where are we? You tell me. Hey, shout out to all 260 y'all over here on TikTok. We are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. You guys go over there and check those out for yourself. But of course, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? I saw some RTs up in here. You know what I'm saying? Hey, by the way, if you're an LPN, if you're a RT, a PT, an OT, lab tech, well, maybe not lab because y'all be saying my shit was hemolyzed and I don't like that. You know what I'm saying? Pharmacy, all of y'all. Hey, I appreciate y'all. I appreciate every single one of y'all. And I, as an RN, love everybody because without each other, we can't make this shit work. You know what I'm saying? So everybody love everybody. You know what I'm saying? Spread the love. Spread love, not hate. We all got to love each other. All right. But the answer is A, right? Check the client for bladder distension, right? Read my name. I don't know. What you mean? RN times 4. Shout out to you. I'm an RT, my last semester in RN school. Shout out to you. Medical coder. If you're a medical coder and you make my insurance like low, then we cool. No, but shout out to you. But if the fundus of the client is displaced to the side, this might indicate a full bladder. The next action by the nurse should be to check for bladder distension and catheterize if necessary. The uterus continues to contract after delivery and its size decreases rapidly as estrogen and progesterone levels diminish. Immediately after the delivery, the upper portion of the uterus, known as the fundus, is midline and palpable halfway between the symphysis pubis and the umbilicus. All right, that's part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. This is both for RNs and LPNs. M says, I'm an LPN here. I'm in my last semester of RN school. Shout out to you, M. I'm new here. I'm a CMA, currently grad. Shout out to you, incredibly crafted. I'm guessing that's what that means, right? Is that something that's just like God crafted me into this most amazing thing, bitch? You best know. I feel like that's what that means. I feel like, okay, I got you. All right, cool. Been at LVN for 21 years. Shout out to you, Nurse Aesthetics. Hey, you work in aesthetics too? I'm trying to tell you. Hey, listen, nurses, all my future nurses out there, there's so many jobs that y'all can do out here that don't require you to be bedside. I'm just letting you know. Here we go. Question number 29. It says, anyone looking for study groups, inbox me. Okay, cool. Hey, build that community. Question 29. A client is admitted to the hospital with a temperature of 99.8 degrees Fahrenheit. Complaints of blood tinge, hemoptysis, fatigue, and night sweats. The client's symptoms are consistent with a diagnosis of what? Is it pneumonia? Is it a reaction to antiviral medications, tuberculosis, or superinfection due to low CD4 count? What are we thinking? TB. Okay. Janae Jenkins says TB. I see you. Everybody's telling me C. Okay. All right. Y'all kind of smart out here. Y'all kind of smart. Kind of, but we'll see. Tony Braxton, stop it. I get you, though. I get you. Ashley, thank you for the follow. Appreciate you. All right, y'all. Here we go. That somebody named Felicia just jumped up in here. You already know what I'm about to say. But Felicia, don't leave. I'm just playing. Here we go. Here's our answer in 3, 2. And the answer is C. It's tuberculosis, right? A low-grade temperature, blood-tinged sputum, fatigue. Oh, man, Lucky, why you do that, man? Why you do that? Now she gonna leave. We don't need her leaving. Fatigue and night sweats are symptoms consistent with tuberculosis. A chronic cough, hemoptysis, weight loss, low-grade fever, and night sweats are some of the most common physical findings of pulmonary tuberculosis. Secondary tuberculosis differs in clinical presentation from the primary prognosis disease. In secondary disease, the tissue reaction and hypersensitivity is more severe, and patients usually form cavities in the upper portion of the lungs. That is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. So shout out to everybody that got that question right. Hey, these are the things that you need to know. Remember, the NCLEX already expects for you to know these types of answers for these types of questions because it's something that you learned in school. It's part of the curriculum. All right. So you have to know and you have to understand that. And if you don't, circle back. This is part of pathophysiology or health alterations or wherever you went to school. You know what I'm saying? So make sure you learn it. Make sure you live it. Make sure you understand it. Okay. Here we go. Question number 30. The client is seen in the clinic for treatment of migraine headaches. The drug, was it Emetrix, is prescribed for the client, which of the following in the client's history should be reported to the doctor. Okay, so something is bad. Something is really, really, really bad for the reason why I'm giving this medication for somebody that has migraine. So what is bad that they found inside of the patient's history? Is it diabetes? Is it Prinzmetal's angina, cancer, or cluster headaches? What are we thinking? What are we thinking? And chest pain. Okay. Simply Emily, I see you. Jenny says B. It's funny. I see Jenny's name and I was talking about Forrest Gump and how Jenny was probably the worst person ever on any movie ever. And I'm pretty sure everybody can agree with me. So Jenny, when I saw your name, that's what that reminded me of. Not saying you, but you know. TK, are you late? No, you're not late. Okay, you're kind of late. Angina. Okay, cool. Let us see what the answer is. B is bad. Okay, Adore, I see you. You guys ever split? What? Did we ever what? The medication can cause headaches. Okay, here we go. Let's see what the answer is in 3, 2. And the answer is B. It's Prinzmetal's angina. So the answer, of course, is B. Let me stop saying of course. The answer is B because, you know, a lot of people don't know that. All right. So if the client has a history of Prinzmetal's angina, he should not be prescribed a triptan preparations because they cause vasoconstriction and coronary spasms. Tell the doctor if there is if they've ever had heart disease, a heart attack, angina, irregular heartbeat, stroke or mini stroke, or circulation problems such as varicose veins, clotting in the legs, Raynaud's disease, ischemic bowel disease. All right. And the doctor may advise not to take, a sumatriptan, right? That's part of pharmacological and parenteral. She says, yeah. Pharmacological and parenteral therapies. All right. Second largest section on the NCLEX exam at, I already forgot. 13 to 19%. I say it all the time. Celine, Destiny, and LaShawn, appreciate the follows. Thank you. All right. So, hey, remember what I tell you all about pharmacology. You better live it. You better like it. You better love it because it does not stop in nursing school. It does not stop on the NCLEX. Pharmacology is ever ongoing and you better know what it is. And if you never know, don't you be afraid to pull that phone out and start looking at the drug interactions, especially like what medications can be mixed together, which medications can be given in the same line, which ones can't be given in the same line, right? Especially for my RNs, when you guys start working critical care, those central lines and those PIC lines. Make sure you guys know it. Make sure you guys live it. Make sure you guys love it. All right. And ladies and gentlemen, that wraps up our questions today on this wonderful Friday. All right. I appreciate everybody that came by and hang out with me. All right. Y'all could have been anywhere else on this Friday, but you were here with me and I appreciate that. So I appreciate everybody for participating. I love all the likes, all the love, all the gifts. While the gifts are not mandatory, they are always appreciated. Samantha, you know, I love having you here. All right. Of course, I'm not going to gatekeep. I got these questions off of nurseslabs.com. You guys can go over there and check those questions out for yourself. They're free sets of questions. However, like Nurse Amber always says, I would recommend investing. There's a big difference between buying something and investing. So invest in a good question bank, like something off of Archer or something off of UWorld or wherever else. Also, you can join the 7-day NCLEX course right now for only $7. It's $7 for 7 days, and then it goes to a subscription of $97 per month. There's 2 NCLEX reviews with content videos that are in there on top of, I do live lectures either once to 2 times a week where we break down questions as well as we go through those important lectures that you need to know for NCLEX. So you guys can check that out at thebootnurse.com/special. Get that free download. I have a book coming out called Conquer It. Make sure you guys go over there and check that out. That link is also in my bio. And if you're one of those individuals who's having a hard time with NCLEX, you don't know where to start, you're having confusion with breaking down questions, content, you need accountability, you have no idea how to get out of your own way. All right. I'll help you get out of your own way. Trust and believe me. All right. But you guys can go check that out over at thebootnurse.com/coaching. So before I do that, I'm gonna turn this thing around. What's up, y'all? How y'all doing? It says, thank you for this. You are very welcome. Can you please tell us the days and times of live? So I go live every Monday, Wednesday, Friday here on TikTok at 5:30 Central Standard Time. All right. And everybody that's over there on the Gram, shout out to the Gram. All right. So, hey, I'm live from both TikTok and the Gram. So what's up, Gram? How are you? Adore, I know you're still over there. It says, yes, which days are you live and times? Yep, I just said it. Monday, Wednesday, Friday, 5:30 Central Standard Time here on TikTok. Why couldn't I find you Monday? I wasn't on live, Chelsea. I wasn't on live on Monday because, I had to adult. Some of us got to be adults around here. You know what I'm saying? It says, yes, you said Monday, Wednesday, Friday. What time? 5:30 Central Standard Time. So make sure you guys are following me and you guys have that notification button on. So that way, if I do an impromptu live, you guys jump on there. What's up, Adore? I see you over there. Appreciate you. It says, had me worried. Oh, I had you worried? Hey, I actually got about 5 or 6 messages asking me if I was okay because I didn't do a live on Monday. And I'm just like, are y'all asking because of me? Or are y'all asking because y'all want that knowledge? Either way, I appreciate it. My fingers are cramping. Good. They better. I know that they cramping for me, though. So I appreciate that. So what questions... getting that knowledge. I know it's okay to be selfish sometimes. I understand I understand, you want to get that knowledge. I have the knowledge to give and I'm giving it. I do it 3 times a week over here and I do it, 2 to 3 times, inside of my 7-day NCLEX course. So that's available to everybody as well. So what questions do you guys have? Adore, I see you over there. So Adore, since you're the only one on Instagram, what question do you have? By the way, on TikTok, what questions do you guys have? And if you're new here, we just finished our NCLEX questions. We do them every Monday, Wednesday, Friday at 5:30. Is it Tamara? I'm a new here, RN student. I graduated in 2025. Shout out to you. Hey, 2025, that'll be here before you know it. You blink and you'll be walking across that stage. Trust and believe me. All right. But what questions? I got 86 people up in here. I want to know who you are, where you're from, where you're at in your nursing journey if you're new here. And what questions do you guys have about nursing school, getting into nursing school, getting through it, graduating, NCLEX especially, as well as, first term nursing stuff. Kelly says, what does the boot nurse mean? So I was active duty in the Navy for 16 years. I had 2 deployments. One was to Guantanamo Bay and the other one was to Afghanistan. And one of the most recognized things from people in the military are their boots and their uniform. So that's one caveat to that. And also in the military, brand new individuals that come into the military, we call them boots, meaning they come straight out of boot camp. So when I became a nurse, I call myself a boot nurse. I came straight out of school. I didn't know anything about anything, but everything is a learning process. And so I stuck with calling myself the boot nurse. I remember I used to call nurses, before I became a nurse, I used to call them boot nurses. I'm like, oh, she's a boot. You know what I mean? So it's a play on words. If you know, you know. If you don't, now you know. So is it Santasia? Thank you for your support. I appreciate that. Going into MedSurg 2. And everyone keeps telling me it's worse than MedSurg 1. What should I expect? You should expect that it is worse than MedSurg 1, Ashley. But one thing I can tell you, like I tell everybody else, is to get into a small group and share the wealth. Split that shit up and then bring it back together. Like split up the work in percentages and then have everybody bring it in. 100% of the work can be done if you did 25% of it, if that makes sense. You know what I'm saying? Because that's how it worked for me when I was in med surg 1, 2, especially OB, right? Because OB just was not my forte, right? So Kelly says, okay. Thank you for serving. I appreciate you. Thank you for your support. Says new here, not a nurse yet. I have to take the T's still. Do you do reviews for that? Thank you. Lauren, I do not do a review for the T's entry or the HESI A2. Now, a friend of mine, Samantha, the nurse Sam, she does ATI T's and HESI A2 reviews every Tuesday over on her page. You can check her out. It's the nurse Sam. She's in pink scrubs. You can't miss her, and she does them all the time. So I would recommend going over to look at that. I catch myself with military lingo too. Hey, that's what I'm trying to say. You'll hear me say tracking all the time. People are just like, oh, military guy. And I was just like, listen, I don't not admit that. I very, very much so, right? I graduate with my LPN in July. Shout out to you. Adore says, I actually don't have any questions right now. I just can't wait for May of 2025. I love it. Before you know it, May of 2025 will be here. Trust and believe me. All right. Is it Mariani? What's the difference between Archer and UWorld? Not really anything. Archer has gotten a lot better with their questions and their rationales. But the biggest difference, honestly, is their price. UWorld's rationales can go a lot more in depth. And a lot of them do. UWorld, I think UWorld's been around a lot longer than Archer has, but Archer has grown a lot. And Archer is not as painful on the pockets as UWorld is. So, but they both, like I said, they both can do the same exact thing. It is how are you going to utilize those tools? All right. From Canada, studying for the NCLEX. Shout out to you, Samar. It says, I love me some Sam. Sam is great, Adore. I love her. She's awesome. Incredibly crafted says, that's what my study group and I do. Exactly. 100%. We split up the work, and that has been extremely helpful. So did you guys ever think that nursing school is meant to be that hard because it forces you to do things as a group? Obviously you can't take the test with one another, but you guys can become part of that interdisciplinary team so you guys can do stuff together, like study together, provide for one another, help each other out. Because guess what? When you become a nurse and you start out here working, the last thing you would ever want to do is be by yourself when stuff goes down. All right. I graduated with my BSN in May. So excited. I love that. Crystal, I love that for you. Sherry Sigan says, prior Navy here as well. Thank you for your service. LPN 19 years. Take my NCLEX in 2 weeks. Shout out to you, Sherry. Shout out to you. Shout out to all my vets and all my military folks that are out there. It's hard kind of stepping away from that. That was my entire adult life. I joined the Navy when I was 19 and now I'm 36. So, all I know is military and medicine, being a corpsman, surge tech, instructor. So that's all I really know. You know what I'm saying? So, but like I said, I took my teaching background and I brought it here. I've applied. I have so many people that says you should be an adjunct instructor. Trust and believe me. I've applied for that. Nobody's ever called me back. So here I am. No, you did not just call me shitmate. Ma'am, we're going to have a conversation. Speaking of studying, I forgot I'm meeting with my study group on Skype right now. I have a good night. Adore, go do your thing. Go get your learn on. I appreciate you being here. Thank you for participating. All right. Hey, over here on TikTok. Hey, and on Instagram, we just got finished doing NCLEX questions. So if you guys have any questions, comments, or concerns, you guys drop them in the comments. We do them every Monday, Wednesday, and Friday at 5:30 Central Standard Time. And right now we're just essentially doing a Q&A. So what questions do you guys have about NCLEX, about anything like that? I had somebody ask me, they wanted to know what the 7-day NCLEX course looked like on the inside. If you're interested in that, it says, except when he has to adult. What do you mean? What? Oh, really, Chelsea? Are you really being like that? Because like I couldn't be here on Monday because I had to adult because I couldn't give you knowledge. You here now, right? Selfish. You're salty. I don't know what you want me to tell you. If you're salty, you might want to start drinking a little bit more water. The last thing I want is for you to get dehydrated. See what I'm saying? It says, as a nurse, are there a lot of snow bunnies in the field? Absolutely. Of course. Everywhere. I live in Texas and it snows all the time. What are we talking about? Sharon RN. What I say? What'd I say? Hey, but anyways, like I said, somebody asked me about looking, they wanted to see what the 7-day NCLEX course looked like or what consisted inside of it. If you're interested in knowing that, let me know and I'll turn the camera around so you guys can see what I'm talking about. And I'll show you guys exactly what I mean. All right, let me see. There we go. As a matter of fact, I'll just do that right now because I know someone, yes, please, I got you. Here we go. All right, so the 7-day NCLEX course, I'm going to do this over here on the gram as well. All right. All right. So the 7-day NCLEX course, this is what the course looks like on the inside, right? So the very first thing is when you come in, you guys are going to see, I'm going to back this up some. You guys are going to see over here towards the left, it says, welcome and join the community, right? And inside over here, I tell you about what the NCLEX course is. Like a lot of people have no idea that they have no idea what a computer adaptive test is. And they have no idea that the NCLEX grades on a computer adaptive scale, right? They have no idea what the passing standard is, and they don't even know what type of questions the NCLEX would ask them. So I essentially do it by telling a story. And then we jump right into the review. So for the 7-day review, there's 6 days in here right now. I'm working on day 7, but the majority, the biggest thing that y'all need to know is the portions that you need to know with regards to NCLEX. So we go over management of care, right? We go over management of care. We talk about it. I'll show you right now. So we talk about it. What's up, Steph? I see you. Or Steffi, I see you. Right? So we talk about management of care, right? Talk about what the sections are. And I also tell you what client needs categories are a part of the questions that they ask you. All right. They talk about, delegation, supervision, and care of a client provided by others, such as the LP and LV and assistant personnel and other RNs. And then we jump right into questions. And when we jump right into questions, it's me up here, my chocolatey self, right? And then I'm reading the question. We're talking about keywords that stick out. We're reading the answers. I tell you the topic. And what the topic does, the topic allows for you to further hone in on what the question is asking you. Okay. It says, I was wowing from the one says she's salty. She's okay. She's fine. She's all good. All right. So that's what essentially what the review does is I go over tons and tons of questions. And to answer the question that I know is about to come up, are there case studies or the NGN updates that are thrown in there? And yeah, they're right there where I go through a case study. Right. And the thing about this is that this is an on-demand course and you can get on there and do it as much or as little as you want. I like to do it over 7 days because I personally have been to NCLEX reviews that have been 2 days and 3 days. While they are effective, for me, it wasn't enough for me to digest because it was so much information. Right. So I tell you, give me an hour. Give me an hour. This video right here, 37 minutes long. The first video is 30 minutes long. Get you an hour of learning about these questions and being familiar with them, right? And then I break them down based off of the client needs. So look, we have management of care right here. Let me bring this in. We have management of care, pharmacological and parenteral therapies, physiological adaptation, reduction of risk potential, safety and infection control, health promotions and maintenance, basic care and comfort, and psychosocial integrity. And then down here, I just finished nursing school and prepping for the NCLEX. This is Jamara. Shout out to you, Jamara. All right. And then down here, I have a separate review with the NGN, right? The new generation NCLEX review. Right. And this is where I essentially tell you what we're going to be going over, what changed with the new generation NCLEX review, what changed with regards to the questions, the grading scale, how they give you points, the different types of questions that they add in, like extended multiple choice or multiple response, extended drag, the close or your drop down, highlighting, the matrix grid, and that's like the bow tie, right? We talk about those, talk about the client needs, the processes, and clinical judgment. Remember, because NCLEX wants you to be able to use critical thinking so you can make a clinical judgment. And then 85 questions in the minimum, 150 questions is the max with a 5-hour period of taking it. And then we jump right into the questions. And we go through 100 questions, y'all. Well, I go through 100 questions, right? So this whole NGN, this new generation NCLEX, This whole thing is 4 hours long that I split into different videos. Look, 99 questions. 99 questions, right? 100 questions. And then we talk about like different delegation techniques, ECG. So the memory tricks and the things to remember when you're taking your NCLEX, right? So we talk about antiplatelets, coags, respiratory, labs, you name it. And then, of course, that's the end of that. It says, do you cover topics like DIC and shock? So, Chelsea, I actually just got finished recording my shock lecture where I was talking about obstructive, cardiogenic, distributive, right? And hypovolemic. I actually just got finished recording that either yesterday or the day before, and those are going to be getting edited next week. And so those videos should be up inside the course by next week, right? And so over here, that's the review aspect, right? So look, the new generation NCLEX review over here to the left. And then after you finish the review, we jump straight in this content, and you can do that at your leisure, right? My very first for NCLEX preparation, my very first video is for NCLEX. I call it NCLEX retakers, right? Because I took my NCLEX multiple times, right? And there's nothing wrong with you. You have to get out of your own way in order for you to prepare better. So we talk about what you could do better as an NCLEX retester, time management, creating a study plan, creative ways to study, lab values, legal, collaboration with interdisciplinary team members, delegation and supervision, the use of restraints. Is this for LPNs as well? Yes, Linda, it is for LPNs as well. Here's the thing, LPNs, anybody's taking the LPN exam, you learn the same exact content that the RNs learn. The only thing that is different is your scope of practice. Like you need to know what you can and can't do and what you can and cannot accept, right? So look, pharmacology. First one, there are 18 videos right here. 18 videos. First one is how to study pharmacology. The second one is dosage calculation. Two of the biggest portions that people have a hard time with. And then we jump into the need to know medications that are pertinent, that pop up on the NCLEX, right? Anti-infective meds, antibiotics, antivirals, antifungals, diabetics, anti-coags and platelets, immunizations, psych, diuretics, IV fluids, blood and blood components, cardiovascular meds, which is extremely important because I talked about that earlier, right? It says, when should we start designating study time to the NCLEX? Ashley, if you're still in school, and let's say you graduate in May, you really should start dedicating time starting in March. That's when you should really start dedicating time to the NCLEX, in my opinion. If you're one of those individuals who's been out of school for a while, you got to come up with a good study plan for yourself, anywhere from 30 to 60 days. All right. And then, of course, more content, fluid and electrolyte imbalances over here. This cardiology section right now, I have deep vein thrombosis, talking about DVTs, right? But there's going to be 9 more sections that are going in here, or 9 more content videos that are going in here to include ECG or EKG interpretation, AFib versus AFlutter, VFib versus VTAC. What else is going in there? Shock, sepsis, myocardial infarction, which includes NSTEMIs and STEMIs. What else is going in there? What did I say? Oh man, I already forgot. There's what is it? Normal sinus rhythm. I talk about normal sinus rhythm, sinus bradycardia, sinus tachycardia, premature ventricular contractions, premature atrial contractions. So cardiomyopathy, somewhere in there. And if it's not in there, that's one that's added to my list of content to do later on down the line. But the most important thing, I needed to get that review out there, and the review is there. Here's your endocrine system, where I talk about DKA, hypoglycemia, diabetes insipidus versus SIADH, right? Hypo and hyperthyroidism, Addison's and Cushing syndrome. Those look familiar, right? So just saying. And by the way, with all of the content videos, every single one of the content videos, you get to download the same PowerPoint that I'm going through. So if you need to print it out or do whatever, and if there's something that I said inside of the video that is not written on the PDF, then you can write it. You can write your own notes in there. Caleb says, how much is this? It's $7 to join the 7-day NCLEX course, and it's $7 to join for 7 days. And then after the 7 days, it goes to a monthly subscription of $97. All right. Now, Something else that's included that I didn't state at the beginning, I'm going to go back up here, but you can go anywhere, right? So I'm going to go back up here. No, I'm going to go back here to welcome. So I'll figure my life out. So you can go anywhere here. I have a community that you can be a part of, right? And it'll take you over there, right? And this actually, it comes part of the NCLEX course, right? So you can actually, and it's like a Facebook group, all right? If you're looking to sign up, you can check that, Landy, you can check the link. If you click my face, that's up here, and then you click my face again, it'll take you to my main page. There'll be a link tree there. And then inside of the link tree, it'll say, join the 7-day NCLEX course for $7, right? You said, yeah, I did, $7. You can join it for $7, right? But then after your 7 day, it's $7. It's $7 for 7-day trial. Then after 7 days, it goes to $97 a month. And you get to be a part of this community that's right here. Not only being part of the community, but you get the 7-day NCLEX course on demand. And inside this community, I do live lectures as well, right? So I did a lecture yesterday where we talked about weekly NCLEX questions. The week before, I did psychosocial integrity, maternal health, and anybody that's a part of the NCLEX course, you guys have access to this, right? And so I also do challenges that are over here. So I do weekly NCLEX style questions, right? And so they got another 2 days before this one is up, right? And I got 20 people that are in there right now. And then I have another challenge, which I call, it's the EKG ECG challenge. And the winner of this challenge, because it's done monthly, gets a one-on-one coaching call with me free of charge for at least an hour. So there's a really great incentive of being over here and being a part of the group. All right. This is so much affordable than Kaplan. I was looking at, Ashley, I've used Kaplan and I love them, but I'm very much more affordable than Kaplan for sure. Very much more. But you definitely can check that out, right? And also, you can actually start up your own little study groups inside of here as well. So, Ashley, for example, if you were in this group and you were just like, Kevin, I want to start a group or I want to start a study session and I want to go over whatever, cool, do you. And I'll be able to see it. And at any point in time, if I'm in there, I can jump in. I'm going to be like, hey, what's going on? What are we learning? And then, I'll go away or do whatever, right? And then also towards the left over here, we have the general discussion, we have the introduce yourself, and we have our wins. So for people that come in here, they will tell us their wins. Like Ashanti was one who posted one in here. Everybody knows my man AJ who passes NCLEX. That was one of our wins. Another one of Donovan, who recently passed and talked about sharing his wins about how he passed. He failed on his first attempt, but he passed on his second attempt, right? Delayed, but never denied, right? And then we go down. You'll see me post motivational stuff. Sometimes I'll pop in here and I'll do a motivational live stream talking about getting out of your own way. It's great. Y'all can come over here and be a part of that. But for $7, you get to be a part of this group, as well as you get this 7-day NCLEX course. And by the way, anytime I update it, you guys will be able to see the updates. And right now, there are about to be 9 videos that are going to be uploaded within the next week. All right. So that in a nutshell is what the 7-day NCLEX course looks like. Right. And of course, if you guys have any questions or comments or concerns, you guys can ask me, of course. But this is my baby and I'm super proud of it. I don't have questions. I only focus so much primarily on content because you have to have content in order to understand what these questions are asking you. However, you do have to have the questions because your test consists of questions. All right. So that is the NCLEX course in a nutshell. So if you guys have any questions about that, of course, you guys can ask me. Right. I'm still hanging out over here on Instagram. For shout out to everybody that's hanging out on Instagram. Is it Nave or Nav? Nave. I'm going to say Nave. Says, wow, nice. Says, yes, sir. Buying it for sure. Love it. Lynn Bay. Love it. Love it. Love it. So what other questions? Shout out to all 72 of y'all, by the way. What other questions do you guys have? What else? Amanda Perez, thank you for the follow. You're welcome, Chelsea. I just now saw that on there. All right. Hey, so if you guys are just now joining, we do NCLEX questions every Monday, Wednesday, and Friday at 5:30. All right, 5:30 Central Standard Time. All right. I'm gonna hang out here for about another 5-ish minutes to answer questions. But yeah, what other questions do you guys have? Yeah, you missed it for sure. You missed it for sure. But that's okay, because you already know we're going to be doing it again. You already know we're going to be doing it again. All right. And by the way, of course, if you guys ever miss any of my lives, you guys can go over to my my YouTube and you can see them over there as well. And I'm also going to start adding my my lives, my recorded lives are going to start going on my website. If you guys haven't been to my website, you guys can check that out. It is thebootnurse.com. What is your YouTube channel name? The Boot Nurse. Just like everything. Everything is The Boot Nurse. So you will go over there and you'll see all of those that are over there. All right. Shout out to all 66 of y'all. What other questions do you guys have? Could be about nursing, could be about NCLEX, could be about school, could be about, imposter syndrome, because a lot of nurses go through that imposter syndrome and they just want to give up. At the beginning of their career, right? It says, yes, sir. YouTube will definitely be where I'm at. Have a good night. You as well. It says tips on how to study for LPNs. How to study for what? Tasha, you got to give me a little bit more context. How long should one study before taking the NCLEX? That really just depends because, if you are still in school, you should start studying at least like 2 to 3 months before you graduate. If you're one of those individuals who have, been out of school for a while, you got to really get yourself a good study plan going on. But I've coached people to where they have studied with me for 30 to 45 days and they pass on their next attempt. So it all depends on how you study and if you study effectively. That is the important part. For an international nurse out of school 9 years, same thing could be for you. It could be anywhere from 30 to 45 days. I will be taking the milestones exam in April. I'm assuming that's like an exit exam. I'm assuming. Well, congratulations. Hey, once you get there, biggest things that you need to study are those really, really big PowerPoints, such as like leadership and management, pharmacology, pathophysiology, understanding the disease processes, how do they affect the body and what you are supposed to do in order to safely take care of a patient. All right. It says working towards 6 weeks, scheduled exam for the first week of May. That actually sounds really good for me, or good for me. That sounds really good to me. Now, it's all about studying effectively. All right. You got to study every day or every other day. You got to study at least 85 questions. I don't know where people came up with this idea saying, hey, I want you to study 20 questions a day. Why? Where? Who in the world would ever say that? On NCLEX, you get 85 questions. So why would I tell you to go study 10 at a time? That doesn't make any sense. Let's know thy enemy. And we know that our enemy is going to give us at least 85 questions. So why would we not study at least 85 questions? See what I'm saying? It says, I've been out for 3 years and I'm hoping to take it by the middle of this year. Hey, Lin Bei, the only thing that I like about hope is the fact that it's in Star Wars. You know what I'm saying? This, like, hindsight's 2020 for me, but in reality, this exam is not as difficult as people think it is. It's the fear of the unknown. And by myself, Nurse Amber, and other NCLEX people that are out here, our goal is to cut out all the noise and have you narrow and have you hyper focused. Have you hyper focused on the things that you need to know. All right. It says, I know the content, but these questions make me nervous. So it could be a combination of both. It could really be a combination of both, right? But if you understand content, which is great, you need to understand what the question is truly asking you. Galen is telling us 100 days. No, you don't need 100 days. When I failed my NCLEX, and then I was hyper focused and I studied on my last attempt, 54 days. It says, I try to do a system over 2 days with 85 questions every day. And if that if that works for you, then cool, that works for you. Everybody's different. You wouldn't see me doing questions every day. I can't do it. I couldn't do it because it wasn't enough for me to digest it, or it wasn't easily digestible for me. Is it Ivy Yvonne? Okay, I'm not going to butcher your name. It says, hello, I finished nursing school last Friday. I started studying already. I love it. Remember, if you're in nursing school, prepare, right, going forward, because that exam's going to come up. Start your studying before you graduate. All right. Get into the routine of studying before you graduate. All right. But those were some good questions. I got a couple more minutes. I'm gonna hang out for another 2 to 3 minutes. So what other questions do you guys have? Shout out to everybody over there on Instagram, which is nobody, but that's okay because hey, I'm live here. And if anybody got a question, I'm here for it. I'm here for it. Like I said, if you guys missed out, we did NCLEX questions on from nurseslabs.com. They are free sets of questions. You guys can go over there and check those questions out. All right. What advice do you have for the day before and of the exam? So the day before your NCLEX, you do nothing. You do absolutely nothing. It's better said than done. But the day before your NCLEX, you do nothing. You need to relax as much as possible. Like I said, better said than done. But the whole point at this point is to relax your brain as much as possible because you have worked it up for the last 30, 40, 60 days. So now by this point, you already know the information. You already know your routine. You already know how to apply the questions. If you're trying to study the day before your exam, you're cramming. And at this point, when you start cramming and you start getting things wrong, your anxiety is then going to take over. All right. Some people are going to do it regardless, but my recommendation is to not do it the day before. Now, the day of the exam, don't take anyone or anything besides yourself. Leave your phone in the car. Take your keys with you. Leave all the stuff that you don't need except for your ID card and your keys. Words of affirmation all the way there. Telling yourself that you will be a nurse. Speak it. You have to speak it and you have to mean it. You can't bullshit your way through that. You can't say, oh, I'm going to be a nurse. Can't do that. Can't do that. So, and as you go there, words of affirmation, words of affirmation, words of affirmation, keeping it positive. Because trust me, as somebody who said negative things a lot during his first 3 attempts, I got a negative result. All right. So there's nothing that you can say to me that I have not already experienced because I've taken the exam 4 times. I felt exactly how you feel. But until I got control of my anxiety, once I got control of my anxiety, hey, look, whole degree, whole license. Just saying, just letting you know. All right. Davey over here on Instagram, it says, what's your advice if you get a few questions you're unsure of in a row? So if you're practicing and you get a few questions that you're unsure of that you get in a row, especially if you're practicing, you definitely need to see what that trend is based off of the content. So is it pediatrics or is it cardiology or is it endocrinology or something along the lines of that? Your exams, when you're practicing, will show you a trend of the area. And then that's where you go and spend a little bit more extra time, such as we'll say like 30 minutes, an hour a day on top of whatever else you're studying to absorb the content. So that way, when you go and you take another exam, you'll be more refreshed and you'll have more knowledge on top of that. All right. Let me see. Somebody else said something. It says really easier said than done. I know. A friend told me her study group each said other affirmations that morning exam. And I like, exactly. Adopt that. That's a good thing. That's a good thing, Ashley, for sure. My man, Dave, you're welcome, bro. I got you. All right. Hey guys, anybody, how to study for ATIP and so scared. ATI, I don't do anything with ATI, but fundamentals is telling me you're in your first semester. So passed my HESI A2 yesterday. That's what I'm talking about. Samantha, on to nursing school. Keisha said, pass my NCLEX next week. Keisha, I love it. I love that for you. Welcome to nursing. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody, what would it be? Congratulations to you. Do you recommend ATI practice exams? I don't like them. I've seen them. I'm not a fan of them. Amber will tell you that they are trash. I feel the same exact way about HESI, which is also trash. I can very, very well speak to HESI because I think HESI is absolute. Did I say trash? It's trash. But ATI, I didn't use it in school, but as I've coached other students and they had ATI, I'm just like, oh no, I don't like this. Let's look into an alternative that is better than this shit. But that was a good question. All right. Any final questions before I get off here? Any final questions? All All right, cool. If there's no more questions, ladies and gentlemen, I appreciate you guys being here. Instagram, I appreciate you guys being here as well. You guys know that I do questions every Monday, Wednesday, Friday at 5:30 on the good old TikTok. All right, on the good old TikTok. So you recommend, so would you recommend UWorld? Yes, I would. Absolutely. I like UWorld. I mean, I personally don't like UWorld. That's just because at the time I was using that tool, I didn't know how to use it. And I was just like, now I just have an aversion to UWorld. But I like Archer. I like Archer. So what mistakes did you make your first few attempts? Well, my first few attempts that I made is my lack of accountability, for sure. My lack of studying, which is also a big one, for sure. Like I'm sitting on the couch with the TV on and an audiobook going on my phone while I got a laptop, me trying to learn stuff off, trying to learn NCLEX. That doesn't make any sense. You have to have accountability for the things that you don't do and that you do. Time management is huge. If you don't know how to audit your time temporarily to take this exam and you're complaining about how you can't go hang out with your fucking friends when your friends are not on your license or your degree, you got a problem. You got to fix that. Right? So, accountability, time management, support system. What's up, Dr. Brown? How are you? So yeah, if I could have gone back and did it differently, if I knew what I knew now, I would have passed it on my first attempt. However, if I would have passed on my first attempt, this conversation that I'm having with all hundreds of thousands of people every other day would be completely different. You know what I mean? So everything happens for a reason. I'm glad that it happened to me that way because guess what? I'm a testament to show that never giving up will allow for you to accomplish those dreams that you want. You know what I mean? Just like PA. You know what I'm saying? Just like being a PA, my guy. So, but yeah, she says, absolutely. What specialty don't you like about ATI? My school makes us use it. Everything. It's just the format. It's just the way that they ask their questions. It's like, I don't like them. Like, it's just the overall product I'm just not a fan of. And of course, your school's going to make you use it is because it's a racket, just like Hesse, it's a racket, just like Hesse. I'm going with Archer. Do you feel like that's enough to ace the exam? There's no such thing as acing the NCLEX. I don't know where people are hearing that, but the NCLEX is a computer adaptive exam. And even if you are doing really, really well, they're going to start throwing out questions that you have never heard of. And the whole goal on NCLEX is to get to the hard questions, period. That is the whole goal on NCLEX. Okay. It says, what do you think of Archer? I like Archer. I do. I taught nursing school at HBCU Community College and two for profit. Let them know, Dr. Brown. Let them know about that background. You know what I'm saying? So what mistakes I answered that one from Dave. Cool. All right. But yeah. So yeah, like I said, y'all, that'll wrap up for today. Make sure you guys go check out everything that I have going on. If you're on Instagram, make sure you guys go to my bio and look at my link tree. Also on TikTok, you guys go to my bio and look at my link tree. Got a free download for over there for y'all. An ebook. You guys can join the 7-day NCLEX course right now for $7. Right? Yeah. No. One. Yeah. And so you guys listen, there's a bunch of stuff that's over there for you, right? Hey, and I do live lectures over there. So there's over 70 videos where I'm about to upload 9 more content videos, 9 for cardiology. I'm just saying. All right. But of course, I appreciate everybody for being here. Wow, that sounds great. Hey, Dr. Brown, let them know what's up. But I appreciate everybody being here. I appreciate everybody coming to participate. But of course, I will see everybody on Monday, and I want everybody to be safe and come back and see us, and by us, I mean me and everybody else here. But y'all come back on Monday. Y'all have a good, safe weekend, and I'll talk to you later.